just to introduce myself, my name is Zubin. I'm an orthopedic surgeon by training. I still practice medicine, but I also lead the health industries practice for PwC Singapore, as well as our Southeast Asia consulting business. And I sit on our global health leadership team. So I'm privy, and I get the chance to see a lot of the technologies coming from around the world, both into Singapore as well as out of Singapore. So hope to share some of those perspectives today. Really happy to see some pretty cool startups, local, homegrown ones. And I guess before we start off, maybe I'm just going to share a little bit of thought and perspective around the home monitoring and chronic disease management before I introduce my friends and colleagues here, and then we can get a bit of an interactive session, if that's okay. So I think just to start, right, just to put things into perspective, what really is revolutionizing remote patient monitoring and chronic care management as we know it? And I think there are a couple of things. I'm only going to spend a couple of minutes on this, right? So I think globally, we see an aging population, locally, regionally, globally. This is something that we see everywhere. We are seeing a huge rise of the middle class, not only a rise of the middle class, but what that equates to is more disposable income in this segment of the population. So people have the money to spend, and they actually have the willingness to spend more on services, and they want more convenient things, and they want the experience from other industries in healthcare, right? We're seeing a huge increase in non-communicable diseases across the globe, so chronic diseases. And I think we often summarize the global healthcare trends at PwC as kind of the A, B, C, and D. So we're seeing a lot of automation and artificial intelligence. We're seeing a lot of big data solutions. We're seeing a lot of consumerism or patient centricity. And I think this is especially important in the home monitoring and chronic disease management space. And lastly, obviously, D for digital. We're seeing a lot of digital solutions. And I think if we put all of this together, it makes us have to rethink the way we deliver care today. It is no longer the same in the past, and it certainly isn't going to be the same in the future. So if we could just move to the next slide, please. Before I introduce my colleagues, maybe just one last perspective. We often use this term, the trilogy of success. And I think for companies in the home monitoring and chronic disease management space or remote monitoring, I think today, if you're a digital health provider of some sort, you need three things to be really successful. The first would be telehealth solutions, right? And often there are many, many companies out there who are providing telehealth in some way or form. In fact, just yesterday on social media, I came across another two out in Singapore that I wasn't aware of, right? So everybody's providing telehealth solutions to the point where it is becoming commoditized. And that's actually a risk, because from an investment perspective, investors are finding it hard. They're struggling to figure out who and what to invest in. And telehealth is a service that is not sufficient to really ensure your success. The second thing, if we look at what Minister Gan said three or 4 years ago, you know, these three beyonds that we are seeing, these paradigm shifts. We're moving from healthcare to health, i.e. prevention. We're moving from hospital to home, so more care in the community and at home. And lastly, we're moving from a quality and volume-based model to a value-based model in terms of reimbursements, right? But if we look at hospital to home, that's the second thing. So digital health providers today, apart from telehealth solutions, they should really have the ability to provide care in the home or in the community, not just through telehealth. And then lastly, and we don't know how long this will be around for, obviously the traditional means of delivering care, right? Your brick and mortar clinics, your hospitals, your ambulatory care centers, your diagnostic centers, your laboratories, etc. So they still exist, and they will likely exist well into the future. However, their business models are changing. If you look at systems around the world, like in New York, the Sinai Health System, you know, they've demolished a lot of their brick and mortar facilities. They've built new facilities, and they've put less beds into them. And sometimes when I look at Southeast Asia, this is quite concerning. From my personal perspective as a practicing clinician, as well as in my PwC capacity, I often wonder if that business model is going to be sustainable, because having more beds isn't the solution going forward. And we're seeing that today. And hopefully my colleagues here are going to share a little bit about what they do and what we're seeing in this space, right? But essentially, this trilogy of success is what you see here on the slide: telehealth, hospital to home care, and traditional brick and mortar services. So as a provider, I think it is important, whether it's you providing all these services or in partnership with others, this must be part of the solution. So I think on that, I'm going to introduce my my colleagues here, and let's get into the panel session, if that's okay. On my right, I have Adrian here. He's the CEO of AEvice Health. On his right, we have Dr. Fahir, who is a medical director at Speedoc. And then opposite me, the lovely Cassandra, who's the founder and CEO of GenConnects. So I think before we ask maybe some specific questions, lady and gentlemen, why don't we start by each of you maybe just sharing a little bit about what your company does, you know, maybe a little bit of background and context, what got you into this space. So maybe ladies first. Cassandra, over to you.
Hi, I'm Cassandra, and we make dementia rehabilitative products, mostly for nursing homes, hospitals, and care centers. We also are trying to do a little bit more of assessments whereby we track different cognitive domains and to see whether the seniors are improving or declining so that we can provide more targeted interventions. What got me into this was my grandpa. He actually forgot how to come home, and that started my journey into creating solutions for people like him.
Great, thank you, thank you. Adrian, Fahir, which of you would like to go first?
So I'm Fahir. I'm one of the medical directors of Speedoc. What we do is basically weave together products which are from Adrian's and Cassandra's fields together with brick and mortar medical services and telehealth services. We started off as a house call medical service. We have since evolved into a telehealth service. And we find new ways of integrating all the different models of care and being an overarching platform to try and achieve this for the elderly and for the very young. Yeah.
Thank you, Fahir. Adrian?
Yeah, hi everyone. My name is Adrian, and I'm the co-founder and CEO of AEvice Health. Now, first and foremost, thanks for having me here today. A little bit introductions about my company. I actually grew up with asthma when I was very, very young. So in 2016, I started AEvice Health together with a professor of mine and a very good friend of mine to build wearable devices that can help patients with asthma conditions get better, translate this information to clinicians over a long period of time. And the idea is straightforward. With a longitudinal data, we empower physicians to actually gain a better insights on how patients are responding to their treatment plan, and so that we can adjust the treatment plan accordingly to how a patient is responding to it. Recently, because of COVID-19, we saw that there's accelerations in terms of adoptions of telemedicine. We have also expanded since then into other chronic respiratory diseases, included COPD. And this is where we are at this stage right now. Happy to share more along the way. Yeah.
So maybe I'll start. You mentioned the Adrian acceleration because of COVID, right? So I think that the first thing is, you know, we're hearing in the market, oh, COVID has caused this, COVID has caused that. I think the first thing is that COVID hasn't really caused anything. It's just really accelerated, as you said, things that are probably a long time coming, right? So maybe the first question, I'll open it to all of you, whichever of you want to jump in. What do you all feel have been the biggest issues that home monitoring solutions and chronic disease management solutions have faced? And has COVID and the acceleration of COVID actually helped make those challenges easier to overcome? Open to any of you.
Probably best place to answer this question. So yes, telehealth relies a lot on visual cues. So the next step beyond that is devices that can feed into this to give us data points to help the clinician actually decide on treatment plans, decide on disease severity, even examine things like rashes.
But you're talking, you guys provide care at home. So are you talking about the telehealth side?
The telehealth side, yeah. So we are different in the sense that we have telehealth as well as mobile health. So if we need to escalate, we are able to send a doctor down for a physical consultation or a nurse down for physical care. But as with COVID and the fact that people were staying at home more, reluctant to going to medical clinics, the first point of care was very quickly becoming telemedicine and then the next step. So when it comes to data points for the doctors, connected devices were the next natural thing. but then there is this hill of cost. And how do we integrate technology cost effectively into telemedicine platforms to try and give the data that doctors require? What it has done is it has broken this process down into stages. Most telehealth companies have been pushed to developing software solutions that can interface with existing devices. And I think the next iteration would be to actually integrate devices a lot more, to shift even patients who used to come to clinics in hospitals for their follow-up, to shift them more into the community and more towards telehealth. So I think post-COVID, in the new reality post-COVID, we're going to find a lot more chronic, ongoing, stable patients' care being dealt with through telemedicine and connected devices. Yeah.
Before I let our other colleagues answer, you mentioned that the cost as a challenge. So how has the cost been addressed? Isn't care just as expensive, or are we lowering our costs?
So it's a case of how many patients can a unit doctor see, or how many clinical problems a unit doctor can solve in a given period of time. Connected devices, by giving us data points, for example, if we have a trend of blood sugar readings over a week, it makes it easier for the doctors to make a decision or come to a decision much faster, put things into context much quicker than if he were to rely on, patient-related, patient's own version of events, or where data can be lacking, or patient's own records without a structure. So what we're doing is we are using structured, targeted ways of collecting data, which actually reduce the clinician's time in doing consults.
And then
and then therefore cost. Yeah.
Okay. Cassandra, Adrian, what do you all think have been some of the biggest issues faced by yourselves and others in this space?
Thanks for the sharing. So I think pre-COVID, I have been observing the field of telemedicine for quite some time. I feel that there has been some resistance in people trying to go into telemedicine because they feel that they want to have that personal connections with their physicians. I personally need to see my physician in front of me to assess me, take my blood pressure, take my temperature, take my listen to my lungs, take my heart rate, to actually assess whether I'm getting better or not. But I guess with COVID-19, one thing that actually happens is with movement restrictions, travel restrictions, we are in a way forced, if I can put it that way, for the lack of better word, to actually hop onto telemedicine in certain countries like the US and UK. With that barrier, the first barrier being overcome, that we start to see more people using telemedicines, there comes a second challenge which we saw quite a lot as a company developing wearable devices and connected devices, is that how are you able to get more meaningful information as a physicians from a patient via telemedicines other than just a verbal interview from them? So I think that is where connected devices company like us are trying to come in. So for example, for diabetes, we know that there are many glucose meter out there you can buy off Guardian and Watson, but we also know that there are connected devices to measure glucose level as well. And this is where we saw that telemedicine are actually connecting glucometer together with patients to translate these informations for doctors on the other hand to better access how patients are doing. In the US recently, we saw that there's a lot of cardio-related devices getting EUA, emergency use authorizations, for COVID-19 as well, just to see how the heart rate of patients are fluctuating over time. And with this information, they hope to translate to the doctors on the other end to better understand their patients. Where I came in is from respiratory field. Taking a respiratory of a patient, even listening to their lungs, unfortunately still has to be done in the premise of a clinic. And that is where we come in. We hope to be able to solve this gap, to bridge the gap, just like any other companies out there, connect us with Speedoc, for example, so that we can help patients to get a better access to care and for doctors to get more meaningful data to improve the outcomes of the patient. Yeah.
Cassandra?
Yeah, so for me, I'm going to talk about monitoring as well as rehabilitation. Most of my experiences are actually with seniors with dementia. So when we actually look at assessing their conditions, right, what's currently done is where you would actually have the seniors come down to a physical setting. You have an occupational therapist or a geriatrician come down and assess their condition, and then provide them with a report, for example. So to actually do that, right, you need to overcome that hurdle of getting the senior down to the center. A lot of times there's always that stigma associated with dementia, and a lot of them do not really want to be kind of like associated with having the disease. So I think one of the challenges in assessing their conditions is that most of it is currently done in a physical setting, and what we are trying to do is to kind of bridge that gap, bring them the assessment through the form of a simple game, and then this provides the first step towards getting a proper intervention treatment. And the second component is in terms of rehabilitation. Rehab is also still currently done in a physical setting. During the COVID period, they tried to move things online. But we also found that it was a little bit challenging because of the activities that are more commonly done in a group setting. So you kind of lose that social factor, which is very important to maintain seniors' conditions for dementia. And I think one of the challenges that other startups in the future can come to address would be how we can actually bring that group activities, still get seniors the right amount of rehab, and still maintain to and still monitor their conditions.
So maybe I want to ask you all something on I think two of you talked about it a little bit. I'm going to play devil's advocate, okay? So I think I was one of the first people to use telemedicine in Singapore, and in Ireland I was using it back in 2005 to 2008. So nothing new to me. However, there are a number of concerns with everything that all three of you and your companies do, right? So I'd like to hear your thoughts on this. You mentioned, Adrian, device, right now physical listening, right? But whether it's a device to listen to the lungs or a device to look at part of the body or assess cognitive function, right? Cybersecurity concerns are huge, right? Especially given everything that happened with our own, one of our own clusters some years ago that was in the news. What are your thoughts on cybersecurity concerns, and how are you all and your organization addressing this?
I think Speedoc scope is a little bit wider, so maybe I'll probably answer this question. So yes, cybersecurity.
I actually was gonna be. I thought it was the opposite because I'm coming more from. Correct me if I'm wrong. Yeah. I mean, do you all use many integrated devices?
Okay, we are slowly adding new devices integrated into the Speedoc app. So yes, so every time you plug in a device, there is a data link, or if you plug into a different piece of software that is not yours, there's an API link. So that opens up a door for data leaks. So we've had to actually proactively look at data security. And we've worked very closely with MOH in setting what the gold standard is in terms of data security, especially after the unfortunate incident we had a few years ago in Singapore. So I think broadly there are guidelines. There are things that are good to have and things that are must have. I think what a lot of us are doing, given the framework provided by the MOH, we have developed systems by which we have data securely stored on Singapore servers, API links between software. They are very robust. Most technology companies, most health tech companies have actually invested in personnel and know-how in actually controlling where the data goes, who has access to data, and reporting mechanisms for any sort of faults that can happen along the way. So there is a development cycle for these things now. Yeah.
So maybe that's on the data front, right? But let me again be even more of a devil's advocate. Sure. I'm talking more about clinical outcomes front, right? Yep. So Adrian, you mentioned there about diabetes. I don't know if any of the three of you read some years ago about the US veteran who hacked into a diabetes pump in a hospital and overdosed somebody on insulin and ultimately caused death, right? So these risks are quite real. What are your thoughts, perspectives on those kind of risks in regard to the devices that you guys are making? What are the risks and how are you mitigating them?
Well, for me, I think I have a lot to learn from you guys. I'm still at the initial phase of designing the tool. So I think when it comes to data security, when we run the clinical trials, for example, there are some measures that we put in place in terms of anonymizing the data, for example. But I can see that you guys have gone through quite a bit, and there's a lot to learn in terms of, protecting not only the person with the data, but also people around them. Yeah.
I guess yours might be a little bit different because it's more of a diagnostic tool, right? Adrian, what about you and the future plans of AEvice Health? Is it not a big risk now because it's more as a diagnosis? What are your thoughts?
So we are in this because there are two product pipeline in our site in our company right now. One of it is a consumer version that we have recently launched. The other one is a medical device that we are quite some way some path away, some time away still. Um, to be honest, I don't have the perfect answer for cybersecurity because I think that no matter how secure it is, coming from an engineer perspective, there is bound to have leaks. There's bound to have a loophole that people can actually exploit, and this can actually cause a systematic failure in terms of the data leak. So, I mean, like what people say, right? If people really want to hack, they put their heart to it to hack. They can hack, unless you put it as an intranet. You close it within the room, but you even then internally people can actually steal it. So, I guess one of the good thing as a medical device is that we are subjected to very stringent standards that is set forth by the EU body. And as a company, as a 1345 company, we do have to try our best to actually follow the standard as closely as we can to maintain it. At this stage right now in our company, because it is a monitoring device, we do not diagnose, we do not instruct people what to do. The risk for us for mixed diagnosis is very low because we don't diagnose in the first place. It's just monitoring. But as we go down the path in years to come, as we progress in terms of technology, in terms of us wanting to position ourselves as diagnostic devices, I think this is where, other than complying with the standards, which is the basic things that any company should do, we will need to have a dedicated team of security, um, which I don't know whether many companies actually do that, but I think that bigger companies actually do spend money on getting a team of cybersecurity experts to be in their company to build up their defense of their data leak. So I think that is something that we have to do, and more to learn from you as well.
Okay. I was going to actually ask another question based on, I think two of you mentioned the term clinical trials, right? Again, correct me if I'm wrong. I don't know. Maybe if you're using devices, Speedoc, you might be involved. But I would say, Cassandra, Adrian, the kind of organization that you're running, clinical trials are important. How difficult has it been for you all to get into clinical trials, whether it's locally, regionally, globally? And is there any support that you wish existed, whether it's by the government or the private sector? Do you think that that is a challenge you guys as well as other startups face?
Yeah, so for the trials that we're actually planning, right? I mean, to run a trial, you need many things. You need funding, you need the partners, you need the seniors to test the product with, you need the approval from their family members. So there's many
You
different
need the
components.
patients.
Yeah, the seniors, yeah. Yeah, definitely. So I think the struggle that we actually faced was the funding component. We actually managed to get everything else in place, but with regards to funding, right, when it comes to running clinical trials, for me coming in as a social enterprise, there's very limited funding that we can actually tap on from the government. So we're actually exploring now social impact funds to kind of fund the trials. So I think it's 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 a little bit difficult as a social enterprise or as a company. But if you were to come in from like a institutional perspective, for example, if you were to create the technology and the science behind the solution from an academic perspective, there's a lot of funding that you can actually tap on through NRF from all the different professors, for example. So yeah, I think this is the main struggle actually.
Adrian?
No, okay, sorry. So I'll answer this question. It's an interesting question because my next trial is upcoming, and we're actually in the middle of, um, without sharing too much informations, we are we are quite near to the end of getting the trial started at this moment, and there are
So what have been the challenges?
yeah. So this is the part that I'm going into it. My challenge here is slightly different for Cassandra. We do have the funding, we have everything, except that we didn't know what is coming ahead of us as we are going forward. So, for example, one of the things that hits me very late stage into the trial was the concept of insurance, that we have to buy insurance. It's a very simple thing. It's just one thing. I think we heard about it, but no one mentioned about it. But before you submit for IRB approval, you need insurance to actually cover your entire trial, right? And you need to actually find out insurance companies out there who can
But
actually,
depending on what you're trialing.
yes,
Yeah.
exactly what you are trolling. So the question is, where do you go for insurance company, right? To look for insurance company, they can actually insure a clinical trial, insure the properties in the area. I mean, in case something happens, right? Worst case scenario, insure the property as well. My approach over here, fortunately, is I do have quite a good friends. I mean, good friends in this field. one of the ex-panelists, Amrish from BioRhythm as well, where I did ask him a lot about, hey, where do you get insurance? And immediately, snap of finger, he gave me the names. And within 1 week turnaround time, I got the names, the price that I need, which is okay, and we are moving forward from there.
Were they local organizations or?
They are local company, or rather international MNC, but they help you.
So maybe you want to share a little bit more, because I'm sure actually that's an interesting angle that isn't discussed much. So for the benefit of other startups, maybe you want to elaborate.
Sure. So there are companies like boutique companies that helps you to liaise with different insurance company to see how insurance company is willing to take up this risk, and they will treat for you. They will actually arrange for you, and if you are okay with the price, you pay for it, and they will cover you. So going back to the point of what help do I actually hope that I can get? I think I used to start off thinking that we hope that we have more consultancy companies in Singapore that can help in this. Some are good, and I think that some may not actually give you the kind of service that you need, even though basically you don't get what you need from a consultancy company.
So take this offline. Anyone has questions about this, Adrian's email is up on that, and please reach out to him and contact him for some advice. Okay.
So I guess building a community of co-founders who have been through done that is actually more meaningful. It's more impactful. And I'm very fortunate because 2 years ago, we started a very small group and it expanded, and we have quite a few of the co-founders of different medical devices and IVD devices co-founders in the same group. So we know that anytime we need something, we just ask, and yeah, someone will actually be there to help you. Yeah.
So maybe I'm going to ask a couple of specific questions to each of you, okay? And since Fahir has been quiet and didn't have to answer, we'll give him a go first. And maybe I ask you to respond as a startup, because I think this perspective is important to other companies, especially when startups are in fundraising mode, okay? And I don't know if all of you are in fundraising mode or what where you're at, but from a COVID-19 perspective, right? We've seen in the market, companies pivot their business models, companies ask for ridiculous valuations, right? How has COVID-19 affected your business? So has it, increased your sales and revenues? Has it decreased? Has it been challenging from a fundraising perspective or not? And what would your advice be to other startups, right? Because many people will argue that COVID-19 may or may not be permanent. Even if it is resolved, other pandemics will come in. So what are your thoughts on that?
Okay, so that's a multi-part question.
Yeah.
So COVID-19 certainly made Speedoc shift our focus. To put it into context, when we started off 2020, we were focusing on developing novel ways of meeting out chronic care, acute care, intermediate care, post and pre-hospital care. And very suddenly in February, March, we had this influx of cases of COVID-19 positive patients. Very quickly, we had to put in protocols in place to recognize these patients, right-site them. And with that, with the government push, Speedoc, among many other providers, were called to assist in the Singapore struggle against COVID. So one, we had to help. It was a national duty. And we had to pull together resources very fast to adapt what we had to what was needed by the community. So there was no option. All GP clinics, hospitals, and telehealth companies had to adapt and had to change and had to cater. With Speedoc, that actually accelerated our push with telemedicine. We realized very quickly what we can and cannot do with telemedicine, given the cost and the numbers that we were dealing with. At one point, we were dealing with hundreds of consults a day, especially with our foreign dormitory workers. And to deliver medicine safely, time effectively, resource effectively was an absolute challenge. And Speedoc had to push to try and meet that challenge. As I said before, we were in a unique position where we are not purely telehealth. We can actually physically mobilize doctors. And the government was very good in recognizing the strengths and gaps in the variety of companies that are available in Singapore. And they leveraged on all of these to try and come up with the combined COVID-19 strategy. So as Speedoc, we were involved with the telehealth part and the dormitory, outreach for medical care. And we also repurposed existing medical devices, like the simple things like the BP cuffs, the oxygen, the pulse oximeters, thermometers, to actually educate lay people, the foreign workers, to use these devices effectively, come up with software solutions to collate these bits of data effectively, and push it to doctors so that they can crunch these data and use it to effectively treat patients effectively, safely, and fast. So we were pushed to do all of these things. At the same time, at the back end, we need to be cost conscious. We need to make sure that we don't, as startups, our funds are limited. We had plans and runways based on those plans, and so we had to actually pivot, reallocate funds to areas where we thought were necessary against the COVID-19 struggle, while not letting down our core business. So I think those were legitimate challenges that all of us faced, but I think so far we, as a community of health innovators, have done well to survive this storm. Yeah.
Adrian, Cassandra, you guys are a little bit earlier, but I'm sure you have a perspective. Adrian, you want to go first?
So I think pre-COVID, the company was focusing a lot on asthma programs. We are trying to work towards the directions, very much for home monitoring kit for patients to actually monitor how they are responding to a treatment plan prescribed by a doctor. That was the general directions then. But with COVID-19 happening, and of course we saw, as we mentioned earlier on, a shift towards telemedicine. I think as a company, we started to shift, just like what Speedoc experienced as well, to think about how can we integrate our services with telemedicine. So that is where, of course, we do have plans and milestones as well. We took a gamble, in a way, if I can, just like any startup, to reallocate our resources in the path that we think that we can actually help patients to access to care, to actually get their conditions better, but yet able to access their physicians at the comfort of their home. So that is where we move, I think somewhere in March and April onwards, when the COVID-19 got out of hand. Would I say that am I lucky? I think that I'm very, very lucky, because as fast as we move towards the directions and we start to speak to a lot of partners around the pipelines that we have, somewhere earlier this month, after 2 months of discussions with the health bank in Dubai, we managed to sign an MOU to actually pilot our solutions with them to service their patients in the Minasa region. And this includes, for example, having a clinic in Dubai, but servicing patients in India and Pakistan and around the regions using our solutions. And it's not just for asthma patients per se. It is for CRD, chronic respiratory diseases, for patients who need the constant access to the doctors to see how they are performing, how they are responding to treatment over time, without having to travel, because they can't travel in the first place to see their doctor. So that is where we took a decisions to actually shift our business. And at the end of the day, we managed to sign the MOU with the health bank, which I think that the team did very well, and I'm very lucky as well.
Cassandra, what are your thoughts? COVID situation.
Yeah, so pre-COVID, it was still generally okay. We were actually picking up. But then during the COVID period, for our hardware solutions, because we have two components, right? The hardware and the software that we are still building on. The hardware component entirely stopped for a while. And at that point of time, it was really quite difficult, because the seniors could not go to the nursing homes. The seniors could not go for like daycare. They were stuck at home, and the only interventions that were put in were kind of like Zoom sessions, and we found that very challenging because of the funding structure as well. But just after a few months, things started to open up again, and seniors were going back to the senior centers, and things, I would say, are pretty much back to normal, but in a smaller number. So I think for the hardware component, it's still okay. For the software component, I can't say much because we haven't launched the system yet. We need to finish the clinical trials first. Yeah.
I guess I'm seeing a few questions from the attendees and audience. So why don't we go through some of those before we come back to what we had planned to ask. First question, with regard to the trilogy of success, could you recap or elaborate further the difference of the component brick and mortar versus the hospital to home? Okay, I guess I'll that's to me. Just to simply share, when we say hospital to home, we're referring to home-based care services or care in the community rather than in the hospital. So rather than a brick and mortar center, so I guess the likes of Speedoc, who we have here, who actually send either a doctor, a nurse to your home or to the community. So I hope that answers that. The second question is for Cassandra. How are the elderly taking to doing games and performing the diagnostics online? I actually think that's a very good question. I'm curious to hear that as well. Are they tech savvy? Are they not tech savvy? Have you developed it in such a way that it's easy?
So far what we have been doing is still in the test phase. We haven't actually launched the diagnostics thing online, but we found that there's a range of seniors. Some of them are really adverse to even touching a tablet. There are others who are quite open, so they will even use like VR for like assessments or cognition. I think it's really dependent on preferences, and as long as there's someone there to teach them as well, they're actually generally quite open to it. We also had like one of the programs done by Singtel Future Makers, one of our grant providers. They taught the seniors how to use phones and taught them how to use YouTube. So they were assessing all the nostalgics.
Was that successful?
Yeah, I think it's been quite successful. You have seniors who are like watching all the different YouTube videos, but at the same time, you also have seniors who are not willing at all. So it's really up to preferences. Yeah.
It's very interesting. Just maybe to add some insights, we've done work for aged care facilities around the world, and for one of the projects we got to go to Amsterdam and China and other countries. And one thing that I noticed that I was very surprised at was sometimes we assume that the elderly may not be tech savvy or don't want to, but then we've seen solutions like wrist wearables or screens where, say, pictures of their grandkids pop up if they touch the screen. And so I think you're absolutely right. We shouldn't write them off, and some are very tech savvy. Either of you, I don't know if you have any thoughts on that, experiences with the elderly and technology.
For Speedoc, usually we have the luxury of having family members dial into us. So the interface between patient and doctor on a telehealth platform is still doctor-patient directly. So the elderly generally don't have to fidget around with the tech part of it. We also recruit the help of the family members to help with the diagnostics. So that sort of takes the guesswork away for the elderly. I think generally the elderly cannot be treated as a homogeneous cohort. As Cassandra mentioned, they come from various backgrounds. We tend to forget who they were before they were old. And given their backgrounds, given their education, and dementia is a spectrum. So given their existing present abilities, they may be able to use a variety of tech tools. And I think we shouldn't write them off. But I think Zubin and I were trained in history and physical examination, and physical examination is evolving into something else now. Doctors need to be trained to examine remotely using haptic feedback, using connected devices. And I think doctors in general are also only now being trained in these new inputs. Yeah, so I think there's a lot of learning going on, learning on where our boundaries lie with these technologies. And I think when it comes to the elderly, much like we do a physiotherapy assessment or a speech therapy assessment, there may come a time where we have to do a technology assessment to see what an elderly individual can or cannot do and tailor our care and approach on that.
Very interesting thought. Adrian, anything to add? Or
I think that's good.
okay. Another question from the audience on the question or concern about cybersecurity. Would insurance be seen as a useful risk management / mitigation tool? I have a perspective on this, but maybe I'll ask my colleagues here their thoughts on that first. Should we go anti-clockwise? Adrian.
Honestly, I'm not so sure whether insurance will actually, I mean, if I get the questions correctly, I'm not so sure whether insurance could be a mitigation tool. I mean, maybe we need insurance to cover that, no matter what. But if it leaks, I think in terms of your company branding, in terms of your company, what you offer, the damage has already been done. We have seen companies who, in the past, because of misdiagnosis, right, they closed down. Today is a little bit different. We see companies where they have data leak, security breach, and this actually bring down a company down as well. So if I get it correctly, I don't think that insurance, I mean, it's something that you need, but I don't think that it will be something that is enough to mitigate the damage on the brand of the company.
Okay.
I think insurance is important as a cushion. I think companies are pushed to be proactive about data security. And I think that's where all efforts should lie. Insurance is on the other end of the spectrum. So should things go wrong, can the company survive? And insurance comes in at that point to help companies survive storms like this. And much like what Adrian said, we don't have pre-existing structures to help insurance companies underwrite these policies. And usually there are broker companies, as you mentioned, which stitch together the products from different insurance companies. So I think COVID, or even without COVID, given the fact that we are innovating in healthcare, we are pushing insurance companies to come up with ways of assessing risk and in a fair way, assigning a dollar value to it to help companies also have that extra cushion to survive.
Cassandra?
Well, I think they pretty much answered the questions.
So I think personally, we do obviously a lot of cybersecurity work, and this is an interesting one because the startups we work with a number of startups now through our venture hub. The most common discussion topic today is cybersecurity, the need for insurance, the mitigation steps, and I tend to agree with you guys that I wouldn't say cybersecurity is, insurance is a risk management or mitigation tool, right? The governance you have in place, the cybersecurity measures you have in place, that is what the mitigation is. I think what the insurance, depending on your funding status and your revenue figures of the company, sure, cybersecurity breaches in the US, you can look up articles where hospitals and organizations are made to pay not even in the millions, but in the tens of millions of dollars, right? So we're going towards a landscape where fines may be very, very hefty. So perhaps insurance is a useful thing to have, maybe a good to have, not a must have. But I think the more important thing is you need to address the risk of cybersecurity breaches and do what you need to do. Another question: importance of changing behavior in outpatient chronic disease management. I'm not sure if that's a question or a statement, or is the question, what is the importance of changing behavior in outpatient chronic disease management? Adrian, you want to give this a go first?
It is very important because if you can change the behavior of outpatients chronic disease management, any devices that go out effectively, you can deploy in the use case.
So let me add a twist to that. Do you think it is or rather, who do you think we have to change the mindset of? Is it the patient today or is it the provider?
So coming to that, if I can twist that question a little bit more, how easy it is to change the behavior of outpatients chronic disease management as a whole in the industry, I would say it's very difficult.
Because?
Right. So in any...
Be candid now.
Yeah. I have two doctors on my left and right.
No, be candid, honest. Yeah.
Okay.
Because we doctors are really difficult groups of people to deal with. We are.
I think for any kind of disease, chronic disease management, there has already been a gold standard way of how we treat patients, a very systematic way of how we get patients to a good outcome. How do we get a patients from not responding well to the treatment to responding well to treatment? So all this has already been there for years, decades, or even more than a few decades. So creating a device like ours is as good as you trying to redesign the wheel, to getting into the hospital care and the healthcare system, to change how people actually adopt your solutions and change the pathway. I do, and I spoke to many companies, mentors along the way. I think as a company, for us to navigate through the way, it's easier for us to see how can we complement existing pathway, or rather than how do we redesign the entire pathway. And also to look for the lowest hanging fruits, which is to look at where is the most pain, where can we come in. So just to take example for us as AEvice as a company, we know that getting adults asthma patients, adult COPD patients, if you were to deploy our solutions out there, the likelihood of them adopting and changing the entire pathway is going to be quite difficult. And that is why we have always been focusing on two fronts. One of it is the pediatric market, because we knew that like any parents out there, you will naturally have the instinct, parental instinct, to want to care for your child. If they are not feeling well, you want to make them feel well, and you will be more readily to adopt the solutions. And from a patient side, from a user side, or a caretaker perspective, we hope that can influence a clinical pathway later on. On the different spectrum, which is on the elderly market, we are talking about resource management, about how do we have so many caretakers to take care of the elderly who are having underlying chronic conditions, and some of them may not even be mobile. So for this front, how we actually want to change the pathway or complement the pathway is not so much about changing the elderly to adopt our solutions, but how can we create value for providers to help them to ease their workflow, to actually allow them to allocate their resources optimally. And from that, we hope, of course, that we can actually integrate into the pathway for tomorrow.
Absolutely. So it's the fear of the unknown. So when it comes to training, I think alleviating fears of the patients is as important as alleviating the unknowns with the clinicians. And I think Adrian would have faced it more than us in how training both ends of the spectrum is a very, very challenging thing. When it comes to Speedoc and telemedicine, or Speedoc and house calls, we have not let go of existing models. Calling a hotline, for example, is still an available option for patients to access our care, while telemedicine also exists. And we don't push for pure innovation ignoring the existing models. And like Adrian said, we have to be complementary. We do not compete. And when I speak to my GP colleagues out in the community, or polyclinic colleagues, this is the exact thing that we say. So much so that the conversation has evolved to hospitals now recruiting both GPs and home medical companies like us to decant patients, reduce hospital stays, in the confidence that we are better equipped to handle patients at home and flag up and escalate in a timely fashion. So I think innovation, modern medicine, if you were to put it that way, does not discount traditional medical techniques, but it's an incremental process of improvement, and I don't think this journey would ever come to an end. So training is for the clinicians is going to be an ongoing process. Training patients to use new medical devices and new medical techniques is going to be an ongoing process. And I think, I think there are more resources now to do that than there was in the past. Yeah.
There's a great article, When Osler Meets Watson. That's a good one. Cassandra?
So I do totally agree in terms of complementing the solutions and the current measures that's already been implemented. I think, for example, if you were to create a solution that entirely changes the behavior of the senior, or even like the caregiver, for example, you would need to find ways for them to actually obtain funding. So, for example, if you were to provide a solution to a nursing home or a daycare center that changes the whole system entirely, you need to find ways to provide that funding. So you need to go up to like maybe AIC or MOH to kind of tweak that funding, because there's a certain way and a certain type of programs that they already fund. Yeah, so I think that's something that's very important.
Yes, since we're going to wrap up, thought maybe we end with some closing thoughts or comments from each of you. If there was one piece of advice that you want to give to all your other startups out there, whether it's in this space or not, what would it be and why? Ladies first, go on.
Okay, so I think one piece of advice that has really worked very well from me, from some of the mentors who have been coaching me, is actually passion. For me, because I work, GenConnects is a social enterprise, right? And all the products that we provide are for like nursing homes and daycare centers. Sometimes it's very challenging when you're not able to find the right kind of fit to get the funding, for example. And things like this, passion actually spurs you further. It pushes you to find different ways to make things work when things are going really wrong at certain points in time. So I think you need to find like aspects or components of the business that really draws your heart towards it, such that if shit gets tough, you're always gonna find a way to solve it.
Here.
My piece of advice is don't expect all the pieces of the puzzle to be available to complete. So we are always going to come across regulatory hurdles, funding hurdles, technology hurdles, unfamiliarity hurdles. So a hurdle should not stop you from innovating, but a hurdle should spur you on to innovate around it. So it's not a case of can I do this or can I not do this? It's like, how do I make the impossible happen and how can it be done with the existing resources I have? So don't let barriers stop you. Of course, to overcome barriers most times needs funding. And I think we are lucky in Singapore that we have more funding or more avenues for funding than most other nations.
Adrian.
My piece of advice, I mean, if probably would be something that if you are working on a medical device or medical related solutions, don't be too surprised with what are the surprises that's going to be ahead of you. And the only way for you to be a step ahead of them is to really band together, very close with all the other startup founders if you can, to learn from one another. And this is what I felt has been quite beneficial for me because I wouldn't say that 10 surprises ahead of me, I would have already seen them coming. But at least out of 10 ahead of me, I've already seen 7 of 8. I know that they are coming. So when it happens, I'm able to react proactively rather than to be reactive about it.
Okay, that's interesting. So maybe I'm going to give this a go and try to summarize what the three of you said. So I think, first of all, Cassandra, when the going gets tough, the tough gets going, make sure you don't give up. For here, if I understand correctly, there are going to be lots of hurdles, lots of challenges, but think laterally, work around it. There's always a solution. And I guess you need to reimagine the possible. And from your point of view, Adrian, actually, I think you're absolutely right. What you describe, often we meet startups in the work that I do, certainly, and the team does. We often meet startups who don't know what they don't know. But I think you're absolutely right. If you collaborate, if you listen to others, if you speak to people, you should actually make sure you're at a point where you know what you don't know. Does that summarize it? Yeah. Out there listening, I hope you have found this interesting. And again, thank you, Catalyst, for hosting us today and for arranging this session. Have a good evening, everybody.